Vaccines sometimes get a bad rap. The current US Secretary of Health and Human Services, RFK Jr., even said this about vaccines.
There's no vaccine that is, safe and effective.
He has suggested that vaccines are just a way for Big Pharma to make money. But that is just wrong. Look at this list. It shows the highest revenue drugs in 2024. In first place, there is Keytruda, a drug to treat cancer. Its sales reached almost $30 billion. In third place comes the weight loss drug Ozempic. If you take the 5 best-selling drugs, you will get a combined revenue of $95 billion. And now compare that to the market for vaccines. In 2024, it was also at around $90 billion. But that is for all vaccines. COVID, measles, mumps, rubella, tetanus, hepatitis, you name it. Vaccines against all those diseases from all producers made less money than just 5 drugs. This alone is evidence that vaccines are not very attractive from a business point of view. And that is a problem. In 2022, a record number of 88 countries reported that they were out of stock for at least one vaccine. This left a staggering total of 20 million children either unvaccinated or undervaccinated, often in low-income countries. That is especially tragic since vaccines are the most cost-effective medicine there is. Every dollar spent on vaccination has a return on investment of over $50 for the society, if you account for averted illnesses, disabilities, and deaths. And it's not just low-income countries that suffer from a bad vaccine market. If pharmaceutical companies avoid vaccines, this affects rich countries too, as it means less research. And according to the World Health Organization, there are still many diseases for which vaccines are desperately needed. So in this video, we will take a look at why vaccines are such a bad business and what could be done about it. Chapter 1: R&D Roulette. Imagine you are a pharmaceutical company and you want to develop a new vaccine. From start to finish, you can calculate with costs of up to $1 billion. And this in and of itself is not even that expensive compared to other drugs that can easily cost up to $3 billion to develop. What vaccines might not need in money, they sure need in patients. Because whereas other drugs usually take about 5 to 8 years to develop, with vaccines, you should plan with at least 10 years of development time. That is mainly because clinical trials for vaccines are tough. Clinical trials for drugs in the US have a median sample size of 223 people. This means that in a usual clinical trial, about 100 people get tested with the real drug, and about 100 people are tested with a placebo. For vaccines, you need more patients. And I mean a lot more. The median sample size stands at over 22,000. That is because vaccines come with some pretty unique characteristics. First of all, whereas regular drugs are tested with people that have the disease, vaccines are tested with healthy people. So in a regular clinical trial, every subject gives you valuable information on the efficacy of a drug. Does the patient still have the disease after the treatment? In vaccine trials, you never know whether the person you just gave the vaccine would have stayed healthy anyway. That is why you need so many people in those trials, so that enough participants are even exposed to the disease. And this is not it. Vaccines also have higher safety requirements than regular drugs. A terminally ill patient might accept some side effects if that means he will at least survive. But that is totally different for healthy people that get a vaccine. The bar for accepted side effects is understandably very low here. But to see whether there are side effects after every 1,000 doses or so, you need to test with thousands of doses. But what about the COVID vaccines? They took less than a year to develop. Well, in many ways, they got a very special treatment. Governments invested billions of dollars into research and development of the vaccines and granted emergency use authorizations for the vaccines. Don't think that for the next regular vaccine, you will get this special treatment. But say you manage to grind your way through all the clinical trials. Now that your vaccine is approved, it should be time to make the real money. Well, this leads us to the next problem with vaccines. Chapter 2: Margin Mirage. You remember how I said that vaccines were the most cost-effective medicine there is? For the industry, that is kind of the problem. Now, to be fair, there is no clear comparison of profit margins for vaccines and other drugs. But what is undeniable is that generally, pharmaceutical companies make a lot more money with drug treatments than with vaccines. A study by the National Bureau of Economic Research found that the ratio of revenue from a drug treatment to revenue from a vaccine is 1.853. So a drug treatment would generate almost twice as much revenue as a vaccine. And if you think about it, that is pretty plausible. Vaccines do not have recurring customers. Normally you get your vaccine and that is it. That is totally different for drug treatments. Patients often take the same drug for years or even for a lifetime. Just look at this extreme example. At the peak of the corona pandemic, BioNTech, the company that produced the mRNA vaccine with Pfizer, reported net profits of around 10 billion euros in the 2 years of 2021 and 2022. The profit margins came in at 54%. That sounds pretty attractive, but keep in mind, BioNTech managed to take a once-in-a-century opportunity there. In 2024, they made 700 million euros in losses. That is not so attractive anymore. You see, the COVID vaccine hype is completely gone, and with it, the profits for BioNTech. Now compare that to the leading cancer drugs. They bring in consistent profit margins of 40 to 90% every year. No global health emergency needed. Financially, they comfortably beat a vaccine against COVID even during the peak of the pandemic. So it's no wonder that more and more pharmaceutical companies shy away from producing vaccines. In 1967, there were 26 vaccine producers. By 1980, this number already dropped to 17. By the year 2000, the market was mainly dominated by only 5 producers. This number largely remained until today, at least for the Western market. Some Chinese and Indian conglomerates have in fact emerged onto the world scene over the last decades. And of course, you could argue consolidation can be seen in every industry. But researchers have found that the poor returns you get for vaccine production are in fact a major reason for the declining number of manufacturers. The regular market dynamics do not properly work when it comes to vaccines. So, what can be done? To answer this question, let's go back to the year 2009. The World Health Organization has identified a big problem: pneumococcal disease. Every year it kills more than 1.6 million people, up to 1 million of them children under the age of 5. At that time, there are already vaccines against pneumococcal disease, but they are not well adapted to the strains of the disease found in poor countries, where it is most deadly. Financially, it just made no sense for pharmaceutical companies. They would have to invest a lot of money into developing and producing vaccines for countries that could never pay back those high costs. Once again, it seemed like there was no hope for a vaccine that would be net positive for society, but financially pointless for the industry. So the global vaccine program Gavi partnered with donor states to set up a fund of $1.5 billion. The fund promised to all manufacturers that it would consistently buy up to 200 million vaccine doses every year on behalf of low-income countries. And at the start of the project, it would even buy at a higher price to cover the initial development costs. That way, pharmaceutical companies would only have to worry about their task to successfully research and develop the vaccine suited for the countries in need. If they managed to do that, they would have guaranteed demand at a guaranteed price. And it worked. In 2010, the first year of this program, 3 million doses of the vaccine against pneumococcal disease were produced. In 2017, the number of doses skyrocketed to 150 million, a 50-fold increase in 7 years. Organizations like Doctors Without Borders have criticized the program for giving more money than necessary to the pharmaceutical companies Pfizer and GlaxoSmithKline, the main contractors for the vaccine. And you know what? They are probably even right. Gavi ignored a cheaper vaccine by an Indian pharmaceutical company, completely switching off the great force of competition. But even if the program itself was inefficient and gave more money to Big Pharma than necessary, It was still an extremely cost-efficient medical intervention. Estimates state that the vaccine saved about 700,000 lives. That would only be about $2,000 per life saved. Sounds like a pretty good deal to me. Vaccines are one example for a product that defies the normal rules of the free market. As you see with the pneumococcal disease vaccine, it can make sense to set prices and demand by the state to give pharmaceutical companies incentives to start producing. Still, all those programs should always leave room for competition among the pharmaceutical companies. The sooner governments and international organizations find this right balance, the better. Not just for children in low-income countries, but for everyone.